Hello everybody. Thank you for joining us today for our webinar entitled Using Psychoeducation in Youth Mental Health Treatment. We're pleased you could join us today. Okay, so I'll be acting as your moderator or host. I'm a clinical psychologist and I work here at Orygen, the National Centre of Excellence in Youth Mental Health. Okay, so I would like to introduce our presenter today. It's Dr. Alex Parker, who is a psychologist and senior research fellow with Orygen, the National Centre of Excellence in Youth Mental Health, and at the University of Melbourne. Alex has been involved in early intervention research and worked in youth mental health services for the past 10 years. She also leads the Headspace Centre of Excellence operated by Orygen. And she'll be talking to us today about the really foundational, fundamental skill of psychoeducation. It's something that I think most of us who have been clinicians working in with young people in mental health have used, but I don't know how many of us have actually stopped to think about how we deliver it. How do we do it well? How do we make it most useful? I think we all agree that it's important, and probably because you've signed up for the webinar, you agree that it's important too. But this is an opportunity to pause and reflect about what makes good psychoeducation. How do we make it more useful to our clients and to their families? So we're lucky to have Alex with us today to spend some time talking about that. We will be taking probably 10 to 15 minutes of questions at the end of the presentation, so do send them through. Okay, thank you, Alex.
Thanks, Karen. And thanks everyone for joining us today. I just wanted to acknowledge before I start that this is a shared effort of work over the years, that we've got an environment here at Orygen where we actually have an integrated clinical and research platform. So I'm drawing on a lot of information that we've gained over the years from our clinical team, and then also from the research that we've been involved in directly, and the research that we've also synthesised and appraised over time as well. So for the purposes of the webinar today, I'd just like to define psychoeducation in the way that I'll be using the term. So it's a specific form of education, and for the purposes today, we're talking about psychoeducation that forms in combination with psychological interventions. So it's combining psychological interventions and education for people who have been diagnosed with a mental illness or disorder. And it aims to help people with a mental illness, or anyone who has interest in mental illness, to access facts about a broad range of information in a clear and concise manner. It also gives us the opportunity to provide clients with the opportunity to access and learn strategies to deal with their mental illness and its effect. So it's not essentially it is about information, but it's also showing that the more a person is aware of their illness and how it affects their lives and the lives of others, that the more control that a person does have over their illness. So that's really the essence of why we're providing psychoeducation with the young people that we work with. I'll just get my mouse set up, so I do apologise for that. So the objectives today, we are looking at trying to increase the understanding of theory and evidence-based underlying psychoeducation. So we'll cover that briefly. We're looking at the challenges of engaging young people with mental health issues with psychoeducation material, and then that leads into that next step of how we actually tailor psychoeducation and adapt it to a client's stage of illness and also to their knowledge level, to really ensure that the message targets what they need. And then we're also going to have a look at some psychoeducation resources and encourage us to think about how we can appraise the quality of those resources ourselves, and to know that they're safe and good to use with young people. So what we do with psychoeducation is to provide information, as I mentioned, but then also to endeavour to create a relationship of communication between the young person, their family, if they're involved in the treatment, and the treatment team. And by doing that, it can also help the clinician understand the young person or their family's explanatory models of mental ill health. So why they think that they may have developed this disorder at this point in time in their life, what do they know about mental illness, and what do they anticipate will happen in treatment, and to also have the opportunity even to consider cultural aspects or influences in this discussion as well. It also gives the clinician the opportunity to understand what a young person thinks about treatment, How are they feeling about engaging in it? What do they expect it's going to achieve? What are their outcomes that they're hoping for? And what do they even think about recovery as a process? Do they think it's possible for them? And what does that mean? Where would they like to be? So all of those discussions, by sharing psychoeducation material, can help us really understand where the young person's at in terms of their engagement with treatment as well. And by doing this, we can also promote hope and optimism for recovery, and by tailoring the messages to match where the young person is at their stage. So, for example, just recently we did a project in the Orygen Youth Health Mood Clinic, where we were testing a manual for CBT interventions. And the first step in that was around providing psychoeducation to normalise the experience of severe depression, but also to highlight how psychoeducation can be used throughout various phases of therapy. But in the feedback that we got from the young people, we did some in-depth interviews with them about their experience of this treatment. We found that the psychoeducation as the first step was so important to them. So it helped them understand why depression was an issue for them right now. It also helped them develop a model of explaining this to their loved ones, to their parents, to their friends, and also for any, to explain to school or to work about what's happening with them. So just by that first step of explaining the disorder, how and why they may be unwell at this point, gave them, empowered them to be able to have really useful conversations about it with the people in their lives. It also looks at how we can engage young people with treatment and begin the recovery process. So we're going to deliver it strategically in order to maximise the positive effect on behaviour and engage in behaviour change. It helps to improve a young person's insight into the disorder, and by doing this we can promote autonomy, this sense of, by again tailoring and checking in and knowing what they want to hear more about and what they don't like, that they can actually feel like they're driving the treatment process. They can also be involved by learning some active psychoeducation strategies about self-managing their disorder and empowering them to help restore some of their self-esteem. And it's really important for them to be aware of all this information so they can also be empowered to engage in a shared decision-making process about choosing what parts of treatment they want to engage in and why. And finally, it also gives us this opportunity to provide strategies for wellness. So we can actually look at some useful knowledge or action-based strategies for psychoed as well. For example, when we're thinking about perhaps the recovery phase, we might be thinking, okay, well, if X happens, so if these symptoms appear, or if a psychosocial stress does occur, that's a sign when you might want to say that's a sign for you to get back in touch with this service, to engage in treatment again, or to think about engaging in some of those strategies for managing your own distress. So we've just had a question in that's asked about whether the slides will be available after the webinar, and they will be all packaged and put online at a later date, so the answer is yes around that. So the rationale for psychoeducation. I think that we can actually sort of see that what it's not mirrors in a sense of what it is. So it's not something that is ever sort of given to it's actually to young people and their families. It's something that we actually engage with to encourage this knowledge exchange that's happening. It's not a one-off activity, so it's not something that might occur just at the start, or it's ways in which we can tailor and adapt and embed it throughout therapy. It's not didactic or static, and it doesn't have to be initially comprehensive either. It might just be a little hook or a little bit of information, and they're thinking about how we'll build on that as we further engage the young person in therapy. It's not the sole task of any one professional that's working with the young person, so we really want to think about how we have a service-wide approach to providing information to young people and empowering them. So then what it is around that collaborative approach, so embracing shared decision-making and providing support and being as informative as possible. So it's ongoing and evolving throughout therapy. And by doing that, we can tailor it to ensure that we're being responsible and it's part of a dynamic intervention process. We need to ensure that all the information we provide to young people is understandable at their level, and I'll talk a little bit more about that in a minute. And then by doing this, by giving them some control about things that they want to engage in and hear more about, things they might not be ready for at this point, or things that they want to hear a bit about, but, you know, let's see how it goes, and I want to hear more about that as it progresses. We actually encourage them and get them in the situation where they're actually in the position as an expert in their own life and in driving their treatment as well. So explanatory models are core to psychoeducation. So I touched on this before, and it helps us to understand the meaning behind why a young person thinks that that they've developed this disorder, and what it may mean for them in terms of their treatment and recovery. So it's really important for our pitch for psychoeducation to vary it according to the stage of illness. And by that I mean, if we're thinking about perhaps that young people are in early stages of illness with mild to moderate symptoms, psychoeducation may be a very useful tool for engaging them in self-help strategies that they might be able to use, explaining why they may be important, and giving them that sense of ownership and empowerment over the interventions that they choose to engage in. Whereas the psychoeducation that we might provide for a young person who has a more severe or complex disorder might be more about managing their medication. It might be about the integration between psychological treatments and their medications, thinking about side effects, knowing when they need to get in touch with the service if they're concerned about anything that's happening. So you can get that sense of saying the information that a young person requires really does vary depending on their presenting issues and their stage of illness. It's often very different between what you provide to a young person and to their family, and having those conversations about what a young person is happy to share with their family. Sometimes it may mean that they're really comfortable with their family knowing broad information about the disorder and how it impacts on young people in general, what are the general treatment approaches, what can we expect from recovery and outcome, but to know that the confidential or the information they've provided in therapy remains confidential. So it's about sharing an overarching explanatory model with their family that they feel comfortable with. I've also touched on cultural understandings, but it really does give us that opportunity to inquire about their understanding of illness, what it means. We know that cross-culturally that we've got, there's a lot of cultures that would feel more comfortable with somatic expressions of mental illness. So it's an opportunity again to gently explore that, and about how family history may have contributed to their treatment experience and their beliefs about illness too. If it's possible in your service to use peers for information exchange, so young people themselves, if there's peer support workers in your service, or family peer support workers, to consider that in the psychoeducation process as well. And the bottom line is, and that's something that I really want to highlight here, is that it has the highest level of endorsement by young people. They want information, they need information, and they also say that it empowers them and provides them with a sense of control over their illness as well. So it is a key stage of any engagement process and therapy process to actually provide information exchange. So I'll touch on some levels of psychoeducation. So we can think about psychoeducation as addressing broadly knowledge. So for example, you might provide some facts. Early on in the stage, it might be about, in your engagement phase of treatment, when you're thinking about normalising the situation for the young person. They might not know much about psychosis or depression or anxiety, and you might give them some simple facts about who it affects, how common is it, that sort of information. So that's for knowledge. Then there's also psychoeducation that we think of adapting it for useful knowledge. So, for example, in a lot of across disorders, or it might be specific for this young person, that lack of sleep can be a relapse factor, and that's useful knowledge for them to know about their illness. Then the next level is thinking about psychoeducation for action. So this is when we might say, well, when you notice certain symptoms, that's when you need to call your doctor or call your therapist. Or there's some ways that we can reduce stress by using some 3-minute breathing techniques, and then obviously explain the theory or the reasoning behind why they might be useful. So that's sort of the 3 broad steps that we're thinking about in terms of psychoeducation. The key thing that we need to also think about, and particularly with working with young people, because we know that they're heterogeneous, they come from a whole range of backgrounds and experiences, and also the fact that we know that young people, which is a strength, that we know that when they're help seeking, they more likely would like to talk to family and friends or informal supports before they then seek formal supports. It also means that perhaps because of that process, they may have heard a lot of misinformation about mental illness as well. So it's our opportunity to very gently work through what they know, what we believe that would be helpful for them to know, and to then find out more about what they want to engage with as they work through therapy. We need to tailor resources to their clients' needs, and the reasons why we need to do this is that we know young people like that more and more likely to read or engage with that information and remember it. It's also considered more credible if it's tailored to their needs, and it's also more persuasive in changing their health behaviours as well. So it's like that idea of, in some ways, of targeted advertising, that we know if it includes a little bit of information that's specific to a person, they're more likely to engage with it. And that's, again, about thinking about moving through this sort of funnel where in those earlier stages of therapy we might be more likely thinking about broad information that sets the scene, that normalises, that gives some of that knowledge information. And now we're thinking about narrowing it down to make it actually useful knowledge and more applicable for that young person who's in the room with you right now. We also need to think about adapting that information to the individual. So we need to keep in mind the age group, the developmental stage, any cognitive deficits that may be co-occurring because of the mental health issues, problems with concentration or memory, for example. Thinking about where they're at with their literacy level and their preferred learning style, so asking them about that and finding out more in which how you can try to maybe avoid more written information and use more verbal or video or online information if that's their preferred learning style. And then also, this is a really interesting point as well, so this has come out of quite a bit of research to actually show that presenting the pros and cons of any information actually helps the clinician in doing that seem more credible and more trustworthy to the young person as well, if we're not just presenting all the pros or the positives all the time. So balancing risks and benefits, and it also helps the young person feel that they've been well and truly informed and being able to make an informed decision about what they want to try with their care. So some practical considerations if the young person does have some attention difficulties is, just like we would with any other aspects of therapy, to give them some extra time for processing that information, to perhaps be very careful about focusing on one area at a time and ensuring that the environment's appropriate and free from distractions to be able to engage in this information exchange, and to keep any information or activities or readings or tasks very simple and of short duration as well. And then likewise, if a young person has any memory difficulties, to think about breaking that information down into smaller pieces, to write information down or to give them some prompts about tasks or activities, to revisit and repeat the information as often as they need, and to perhaps consider giving written or verbal reminders as often as needed, so follow up with some notes or some phone calls or emails between sessions too. So again, the same considerations or principles that you might follow to encourage engagement in between session work, or to break things down to ensure that it's meaningful and it's pitching at the right level for that young person too. Now, I just wanted to touch on a very special note about substance use psychoeducation. So this is emerging over the literature over the last few years. So you may be familiar with or have seen a lot of prior psychoeducation where I think to look definitely, with the right intentions in mind, to look engaging and meaningful for the young people, that there used to be information that would contain pictures of perhaps the substances, pictures of needles and bongs and things like that on information that was about substance use. And nowadays the thinking has really shifted to actually focus on positive material, so not to include pictures like of stop signs of smoking and no images of any substances or the paraphernalia involved in that. To think also too about the psychoeducation approach that needs to be stage dependent, so it will vary depending on whether you're working with enhancing someone's engagement in therapy and trying to increase their motivation to change, versus to the middle stages of therapy and then thinking about relapse prevention and recovery at later stages. And to also remember that a young person's cognition may be compromised by the use of substances or current intoxication, and to adapt messages if need be. So the reason, again, I just want to touch on why we're avoiding these images is that the research has shown from a whole range of sort of functional MRI studies that by showing images of substance use, it can actually activate the addiction or craving parts of the brain in people who use substances. So by showing them materials that have those images on it, we're actually activating the craving or addiction part of their brain. So it's best to actually, again, focus on positive material about why they need to think about changing rather than showing what they need to be avoiding. The model that I'd like to talk about for psychoeducation, and I don't know if having mnemonics helps with you, but this one I can remember because I think psychoeducation, Pepe, and that's my Pepe Le Pew accent. I shouldn't have, maybe call it PP. I'm not really sure, but it's about providing, asking permission to engage in talking about information sharing with a young person, to elicit their views on some original thoughts about the situation that they're in, their current experiences, provide that information, and then to also elicit their responses to that information. So it can also be thought of explore, inform, explore as well. So permission is the first important step, and it demonstrates the spirit of motivational interviewing, where we're coming at with an acceptance and collaborative approach, as opposed to us being the expert who's telling or lecturing. So permission can be implied if a young person asks for advice, or when the clinician is offering advice, allows the young person the opportunity to discount that if they don't think that it's true for them. And it's also obviously explicitly given when a clinician asks and a young person says that permission is granted. So then after receiving permission to explore this, we then look at the elicit components of that. So by asking permission, it could be sort of something like, I don't know whether this information is important for you at the moment, but I've got some information from your assessment I'm thinking about. Can I share it with you? Once you actually have that permission, you might want to ask them what they understand about. So what do you understand about psychosis? What do you understand about why your relationship breakup may have contributed to how you're feeling at the moment with your mood? Questions like that, and we can get a sense of how they understand why this illness has occurred for them at this point in time. Then we'd actually ask them whether they're interested in hearing about some information. So would you be interested in hearing about where your substance use fits compared with other young people your age? Are you interested in hearing about why it's really important to think about changing your thinking style when thinking about why you're feeling down and depressed at the moment? And then when that information has been provided, to elicit their reactions to that information. So what are your thoughts about that? How do you think it applies to you? Do you think that information is right? And it's more effective to elicit their response than to tell your client lots and lots of information. So that is a very important stage at the end, to think about what do they think about that information and check in with their understanding. So for example, in the middle of a client I've been working with in the middle of his therapy, he had actually already had therapy in the past and had some basic understanding about mindfulness strategies. But the stage that we were at in our therapy, he was really keen on this idea of unhooking from some of those unhelpful thoughts. And we talked about some mindfulness strategies and provided some examples of ones that he could use, but then also linked it in with the way that it actually will provide that distance from or diffusion from those thoughts, so a sense of that he was feeling quite overwhelmed by thinking, because he thinks something that it's true and it is true about him, and to be able to talk about how that's the mindfulness strategies help provide that distance between thoughts and him was very useful information to be sharing when reintroducing that technique with him. So after viewing some information, whether that be written information or it might be videos that you've shown online or videos that have been prepared within your service. You know, for example, here at Orygen, we've got some videos about young people's experiences of treatment or substance use, and there's a whole range of materials that I know that different services have available. So once again, we sort of seek that opinion from the young person. So we might say if there's actually if it's an evidence summary or a fact sheet, so, you know, do you think these experts have the full story? Do you think they've got it right? You know, this committee thinks that cannabis use will cause problems for most young people, but do you think this is actually true for you? And to talk a bit more about their beliefs. And if there's any stories told, you can ask the young person how the experiences, you know, the people in the video might be similar or different to their own. You ask, you know, do you think that can really happen, or do you think he is a typical case? Do you agree with this? Why or why not? So they're all really important questions to ask when we've actually shared some information with a young person. After viewing information as well, we've got to think of some creative ways that we can help a young person engage with that information. So it might be that we say, well, can you imagine if we're going to actually give a quiz to other people on this, what questions would we want to ask, and what would we want them to know and be able to answer? Or if you needed to design a poster or a flyer or a fact sheet, what information would you want to put into that to actually ensure that young people understand about this? And consult with the client as in their expert position with regard to the content of the pamphlets, and ask them about the new information that they've gained. And in this example, specific to cannabis use, but that's across the board as well. So how it affect their attitudes to treatment, to use, to informing others about their experiences. All of those questions are very important as well. So by doing this, we can actually give the young person some agency, so we can literally place them in the driver's seat. So if we're actually wanting to show a video or something online, we can sit them at the computer and give them the mouse, or if it's on video, the remote control, they can stop and pause and ask questions when they want. Write notes on a whiteboard if they're thinking about points that they want to actually remember or think are important to share. And then as we go through that information, we really need to make that personalised summary for the young person, so it can be fed back to them in a novel way or fed back to them in the most relevant way depending on their preferred learning style. So it might be summarising things and sending them in an email, writing them on a postcard, other ways that we can think of that actually help a young person to remember and engage in that information. We want to also include questions to help guide their reading if they're looking at written material. So it might be, you know, to consider how strong are the different kinds of marijuana. It might be about thinking about, you know, which types of psychological treatment have the most evidence for use with in young people with depression. Develop ways of repeating or providing booster information in future sessions to help reinforce the learning. And any information that you do give, one other, you know, quick tip is to think that a young person doesn't have to necessarily go away with written material. They might take photos on their phone to remember. So if you've actually written some notes on the whiteboard and you don't actually have one of those printable ones in your office, they can just take a photo and take that information away with them as well. Sorry, I've lost my mouse. There we go. So when we're thinking about providing information to young people, we like to think about making that information as engaging as possible and to use relevant information for examples, and adapting that and tailoring it to their age and their developmental stage. I've also touched on before about this idea of course of illness and treatment, so thinking about how the messages need to be targeted at different stages as to whether we're engaging the young person in treatment, if they're in the middle of treatment, right through to thinking about preparing for relapse prevention and knowing about early warning signs if they need to get back in touch. Tailoring it to their personal interests and their literacy level, and making it as personalised and attractive or youth-friendly as possible as well. So we know there's also just not a one-size-fits-all approach for this. So there's great resources that are available, which I will highlight as we move through. But it's also about working with that individual young person each and every time to ensure what amount of information in a fact sheet or in an evidence summary or on a website is applicable or useful for them, and what are some of the things that they think are not as relevant. And by having that conversation, we also get an idea about where their motivation level is, how committed they are change and changing their health behaviours too. So at all these points in time, we need to consider the formulation of the young person and targeting these messages depending on what we know about how and why they've developed this illness at this point in time. So a range of psychoeducation topics to support young people and their families in understanding. There's many. So we might think about what is mental health, what are the causes, what are the treatment options to consider, and also staying well and relapse prevention. We might also think about how we can construct new resources from the information that's available. So to consider novel and engagement formats. Think about resources having good layout, that they're attractive and easy to read, and appealing graphics or colourful, or use new technologies. So for example, this one here is like a word finder, and I was speaking to a colleague of mine who has had a lot of experience in working with young people with substance use issues, and the engagement phase, particularly for working with young people with substance use, is very important. And she was telling me about a client she had a few years ago who was very difficult to engage. So she was attending treatment but wasn't quite engaged in that, or even thinking about that she needed to actually change her substance use at that stage. And the clinician had noticed when she had been arriving to appointments that she seemed to always be pulling out one of these like word puzzles and doing that in the waiting room. And so she actually then looked to create a word puzzle that in order to find the words, you actually had to answer some questions about from the pamphlet about cannabis use. And the young person didn't find exactly the word puzzle the most fascinating thing that they had ever engaged in, or went, oh wow, this has really changed my life. But it provided an opportunity for her to actually say to the clinician, you know what, by you going to this effort in making a resource that taps into something I'm interested in, it's made me realise how important this topic is, because you've invested so much time in it, and I'm willing to hear a little bit more about it now. So it was sort of a stepping stone to increase engagement and to move to a different level of therapy. In those earlier phases of treatment as well, we might also be thinking about some of that information that we need to share that are about legal responsibilities and expectations of the client and of the service and of families. So at this stage, the clinicians can provide information about their role as an advocate for the young person, to provide information about the limits to confidentiality and how we can work together, so involving families and checking with the young person about the information that they're willing for the clinician to share with their family, and which that they would provide, wish to remain confidential. And as I mentioned too, working through those limits to confidentiality around safety and risk. Talking about the rights of the young person in terms of accessing a service and their treatment rights. Talking about our ethical obligations as clinicians, and if we have to consider, depending on the stage of illness and the severity of the young person, information whether inpatient admission might be appropriate depending on where they're at and their needs. So selected per case, you might be thinking, as we said, what is mental ill health? Causal and triggering factors, the symptoms, the course and outcomes. So this is again all about that knowledge and useful knowledge element. Service options might be also getting into shared decision making and useful knowledge. And then those treatments, so knowing the difference about psychosocial treatments and medication and other therapies that might be possible. So this is again tapping into this idea of actually providing all the information. So providing the risks and benefits for certain treatments, whether it be psychological or medication or other forms of therapy, that it's actually empowering the young person to know what are the risks associated with trying a certain treatment, what might be the harms, or whether it may work for them in that particular case, and then knowing about a balanced view of what the benefits might be from doing that. It also might mean the pros and cons of change in terms of thinking about stopping using substances, or it might be the pros and cons of change of thinking about not relying on self-harming strategies to manage distress, and thinking about other strategies that they may wish to use. And so again, by looking at a more balanced view, it helps the young person to see that the clinician's actually thinking about working with them with where they are, and also seems more credible and trustworthy in the information that they're providing as well. And again, we might be thinking about whether the young person in later stages of therapy might need some more information about sexual health, about diet, physical activity, physical health, metabolic monitoring if they're on antipsychotic medication, risks associated with treatment withdrawal or alcohol or other drug use, and their rights and responsibilities in treatment and accessing the service. And then those later phases of treatment, be thinking about early warning signs, relapse prevention, and ways in which they can manage their own distress. So there's many, many ways that we can provide information and help a young person understand why we're suggesting or why we think that certain approaches might be useful for them, and for them to think about what they would like to try. At a service level, we need to think about creating a supportive environment, and as clinicians to discuss at clinical review and other team meetings how we're approaching psychoeducation. Communities of practice might be a useful resource for clinicians to consider as well. And as supervision, it also gives us that learning space to actually expand on psychoeducation approaches, to learn from other clinicians and to share any metaphors or analogies that we might use in our treatment approaches or methods which we know have been helpful in the past. So learning from others that you work with, learning from your colleagues is really important as well, particularly about thinking about staying on top of being engaging with young people and knowing how to meet young people with where they're at culturally. Also, other service level considerations that we need to think about providing adequate resources, so online and appropriate technologies as well, to provide opportunities for peer story sharing. So this is actually a valuable opportunity for the young person themselves to be able to share their story, but by also having a bank of resources available around this, it actually enables us to use other young people's stories in providing psychoeducation with the young people that we're working with. To think about linking to local providers for more information, and to think about whether multiple languages or interpreters might be necessary depending on the young person's background. And if no family peer support is available in your service, there are options to linking families in with community family peer support programs that your service may have close connections with. Discuss with families what options are available either online and also phone services where they might be able to connect, and also provide families with written personal accounts and video personal accounts of other families' experiences of young people with mental ill health as well. And it may not be the option for your service to have family peer support workers there, but maybe able to think of other ways in which you can provide some group psychoeducation for families too, either as a one-off or at various stages through the treatment phases that the young person's connected with your service. So when it comes to psychoeducation now, I think that we can't avoid thinking about the online materials that are available as well. So thank the Young and Well CRC for allowing us to use this infographic, and it's just to highlight how common it is and how often used it is by young people, particularly this idea about we know that they're accessing information privately, potentially late at night, and to check in with them about when they're actually accessing any information about their mental health, about where they're finding it and how reliable and safe is that information too. So it's really important as clinicians that we ask young people about where they are actually gaining their information and their views and beliefs about mental illness. So these are just some questions to think about before downloading an app, and I'll also talk about a rating scale that we can use as clinicians to be thinking about this. So it's really hard, as we know, that all this information is proliferating at a great rate, and there's so many apps that are available, but there's a few things that we can think about before downloading and recommending an app to a young person. Thinking about who it's published by, how often it gets updated, is it referenced, do we have an idea about who the authors were, has it been peer reviewed in any way? So these are really important questions to consider. Has it been recommended by a university or a healthcare institution? For the young people to consider whether it requires them to input any specific data and how private that information is, and also to think about if it's who's been produced by, if there's any conflicts of interest as to who developed the app. So I mentioned that there is a rating scale. So again, this is developed out of the work by the Young and Well CRC, and you can find this full rating scale online if you look at their website, and we'll have their website later on for you to see how to find it. So the mobile app rating scale actually gives us this opportunity to rate the quality of an app by how engaging it is to a young person, the functionality of it, so its ease of use, how it looks, the aesthetics, and then some about the information, so the quality of the information and its evidence-based. Now this is the hardest one, so point 4 is the hardest one to rate because it can be very hard to find that information. As a broad rule of thumb, I think it's about any app that actually is building on what we know is an evidence-based intervention in face-to-face would be a useful starting point when we're thinking about using apps to enhance the work that's done in face-to-face settings. Also thinking about finding resources. So with the Beacon website, it's not only just finding links to sort of online programs or links to service providers. You can actually, if, for example, looking in here, putting in around cannabis and young people, can see that they can actually have some access to some online fact sheets and also videos and other information as well that might be useful for the young person that you're working with. And so the take-home message is to think about including new media, is to know that it's new and we're all learning all the time. And so it's like all media that we need to make some discriminating choices about what we use and what we recommend to young people. But we do know it's meeting them where they're at because they're highly engaged in using technology and they're high-level adopters. The range of options is broad and will only get wider. So that's why we as clinicians need to be thinking about the quality of any information, thinking about using rating scales like the MARS so that we're actually equipped to appraise that material before we share it with the young people that we're working with. We need strategies to keep up to date with information without feeling overloaded. So again, that's another opportunity to tap into what peer supervision or clinical review in the service that you're working with, finding out what your colleagues are using and how that's worked with other young people. And you also need a range of options that work best with your style as a clinician and also with the young people that you're working with. So it's really important also as a clinician that you know exactly how to use any app before you recommend it to a young person because you need to actually know how to walk them through and how it links in with their therapy. We've got some resources that are available online at Orygen. So at the Orygen website, we've actually got a manual available that looks at a shared understanding of psychoeducation in early psychosis. On our website as well, you can find some fact sheets and mythbusters, and again, that can be useful. So some of these have been developed in partnership with young people. Some of these have been developed to provide evidence resources for clinicians working with young people. But all of this provides you with a source of information to be able to say, where are some bits and pieces that I can take from this resource that's relevant for this young person that I'm working with? What are some bits and pieces that they feel aren't so relevant, because that also tells me something about where they're at right now in terms of what they need. We've got lots of resources that are available on the Headspace website as well, so fact sheets and information directly for the young people, but also again information that's for service providers working with young people. NICPIC website has lots of information, clear fact sheets and research summaries for substance use and young people, particularly focusing on cannabis use. Beyond Blue, Black Dog, Yoda and other sites have lots of psychoeducation. We've got also videos, for example, on Beyond Blue, they've got some videos that show actually what young people can expect of going into therapy for the first time, to understand a bit more what psychological treatments are like. So again, this might be information that you choose to watch together in a session or to provide a link to the young person that you're working with to help them be better informed about and to be able to drive their own treatment. So I'll show the reference list in terms of some resources that we referred to in the webinar today, and we will also make these available for anyone after the webinar. And just a reminder that if you do have any questions that you can type them in now, so we've got the opportunity to have some questions and answers if anything does come through, and that all this information will be posted online at the Orygen website at a later date, so not too distant future, that you can actually see the slides and hear the webinar again. So I just thought I'd take a moment just to wrap up, and then we'll look at taking some questions. So as I said, feel free to type some in, and then I can actually, we can look at some of that information. So just in summary, I think that the key message about psychoeducation is this idea of providing greater awareness of the illness in order to lead to greater control over the illness. Psychoeducation is ongoing, and it's a collaborative form of communication and information exchange. It's not a one-off, it's not didactic, and it's used at various stages of treatment. It's an information exchange not only for knowledge but also for actions. It helps us to explore the explanatory models that a young person and their family have about mental illness, and also the young person's attitudes towards treatment and recovery. So this is all important information as a clinician that we can get back from this process of talking about this with young people. We need to think about how we take existing resources and tailor them to the individual based on their age, on their developmental stage, on their illness factors, for example, cognitive impairment or lack of motivation, fatigue, tiredness, all of those things that are involved in being unwell. How much family involvement they're comfortable with, the stage of treatment. So I did speak about how, broadening at the start when we're looking at engagement, and normalising phase down to more targeted messages as we go through treatment. And looking at ways in which as clinicians we can help each other through supervision and through clinical reviews, and talking to colleagues about sharing metaphors and analogies and resources that work with young people. And that last point about, as clinicians, knowing how to appraise the quality of online resources and apps before we recommend them for use with young people. So they're sort of the key issues that we want to think about today about adapting psychoeducation for young people. I think in wrapping up, before we get questions, I'd really like to say that we cannot stress enough that the research has actually shown that young people want and need this information. And in and of itself, it's a useful phase of therapy to actually have this information, that they've got that greater control and understanding about their illness. Okay, so it looks like we've got a few questions coming in, so I'm going to try and balance looking up at the other screen to have a look at some questions and see what I can get through today. So thanks for those who have sent through their questions. Okay, so the first one, I've been asked about whether it's necessary for young people to be in remission for effective psychoeducation to be given. And I think that that's a really good question that's tapping in back to that idea of ensuring that we've actually adapted it, or it's sort of stage specific in terms of the treatment phase that the young person is in. So certainly when a young person is in the recovery stage, there's a lot of psychoeducation that can be provided about ensuring that they stay well, about early warning signs to look for in case some things do change, and that they need to get either back in touch with the service or their clinician, or think about those self-help strategies that they can re-engage in if they have that, if that can be useful. So it's certainly about targeting the messages when they are approaching remission and recovery and perhaps discharge from a service. But clearly there's opportunities along the whole way of engaging with a young person in their treatment phase to actually inform them. So right at the start, it helps to empower them about treatment decision making, knowing the risks and benefits of certain treatments and ones in which they'd like to try. That it can also help with normalising their experience and help gently correct some misinformation that they might have about how and why they've become unwell. And then throughout stages of the treatment, that it can be appropriate again when a new technique gets introduced, or thinking about some between session work that they might want to do, and to give them as much information about why it's important and why it's necessary for them to think about including that in their treatment. Okay, so I've got some a question about engaging with a young person who doesn't want to talk to their parents about how they're feeling because there might have been some past negative experiences about mum and dad not knowing that they had experienced mental illness, and yet they do need consent to access help. So that's quite a tricky and complicated situation, and it's not one that we don't encounter in the work that we do. Again, the questions around saying how and why this family has come to this belief around mental illness is very important. We need to think about how we might gently encourage a young person to disclose some information to their parents that might be more generic about the facts, the knowledge, how we know it's a key issue for young people, that mental illness is likely to be, is the disease most likely to affect young people at that age of development and creates a lot of burden on them and on their family and on society. So providing some information about how and why mental illness affects young people generally without making it personal about this young person might be useful. But also thinking about how we can actually provide some services in terms of engaging the parents with the model with where they're at as well, and using it as an engagement point to start with. So it might be more thinking about, is it more appropriate to pitch it more as a medical model at the start for parents to feel more comfortable with their child engaging in a mental health treatment service, and then working with them over time to actually challenge and adapt some of their views. Okay, so the question about cost-effective psychoeducational interventions and which ones are best value for money, I think that's a challenging question to answer, because I think a lot of work needs to be done about exploring that with the research, about knowing more about which things work. We do know, though, that providing psychoeducation in the early stages, or for young people or any people with mild to moderate presentations of illness, can actually empower them to do make some basic changes and include some self-care strategies that can actually prevent more serious illness developing. So there's an element of it being cost effective in that way. But I think a lot more work needs to be done about how it actually benefits at different stages, and how best to integrate it into treatment. Okay, so I don't think at this stage that there's any more questions coming in. So at any stage, though, if there's any further questions, you can also post them online or send them into the training email address at Orygen, the Skills and Knowledge Training email address, which will be available. You'll be able to see how you can access that too. And so I will actually hand over to Karen now, who will sum up and also give you information about future webinars. Thanks for your time today.
Thanks very much, Alex. I think you'll agree that although most of us think we do psychoeducation with our clients, that we do it regularly, our presentation from Alex today has got me really thinking about what good psychoeducation would look like, and how if you do it well, it actually becomes something that is ongoing and can assist us with both our assessment of where the client is up to and how they understand what's going on for them. But also it starts to introduce some very therapeutic concepts. So it isn't just something that is unidirectional and information giving. It very much, when it's working at its best, becomes something that is done together with the client, that is both information giving and therapeutic in its outcome. So I hope that's given you all pause for thinking about how you engage in psychoeducation with your clients, and gets you thinking about what more you could be doing to make it most useful to them, both in the early stages and ongoingly throughout their treatment. So thank you for your time and for attending. We will be uploading the content from this webinar onto our website in the coming week or so for you to be able to come back to and have a look at, so that you can access the information, re-watch, share with your colleagues. We also wanted to let you know that the next webinar that we've got coming up is presented by Dr. Chris Davey, who is a psychiatrist here and research fellow here at Orygen Youth Health, on the 15th of March at 10 o'clock, looking at antidepressants and their role in the treatment of young people with depression. So we hope you have time to be able to come and join us for that one. We talked a little bit in today's presentation about the role of technology in psychoeducation for young people. It's an emerging field, and many of us clinicians, particularly ones who have been around a little longer, find that it's taking us a little bit of time to catch up to where our clients are at with using technology. It's something that's useful for them. It's something that we feel that we should be incorporating into our practice. But I know that clinicians like myself feel that we could use a little bit of extra help in catching up to where young people are at with using technology in our practice with young people. So if you are interested in getting some more education around this area, you might want to check out a new certificate that we have available, an online set of modules around using technology in treating young people with mental health difficulties. It's available for you to review on the Orygen website and also on the Young and Well Cooperative Research Centre's website. So have a look at that if you're interested. Okay, thank you for your time today. Thank you to Alex for her fantastic presentation, getting us all thinking more about psychoeducation, and we hope we see you again for our next webinar. Thanks.